presentation. My name is Andrea Horvat-Kramaric and I'm the Head of Communication and Spokesperson at the ECDC. So today, our press briefing, just let me give you some small information. It's supposed to last 45 minutes, and at the beginning I will give the floor to our commissioner and to my director, Andrea Amar, and then afterwards I will kindly ask you to ask questions, and when you do so, just introduce yourself briefly and where you're coming from, and hopefully you will have all the answers you need. So, Commissioner, are you ready?
Okay.
Always.
I'm ready.
Yeah, the floor is yours.
Like always. First of all, thank Andrea and ECDC for hosting this event. World Antimicrobial Resistance Awareness Day is, as always, a key momentum to stress the major threat that antimicrobial resistance represents not only in Europe but on a global scale. And I ask media to be more active, healthy custody senators in the message. We often hear that it is a major public health threat. I wish that this threat has the press coverage that it deserves. Indeed, 100 people die every day in the EU because of IMR. It is not a random number. They are our family, our friends, our colleagues, our neighbors, our relatives. We all have a role to play in the fight against IMR. As a medical doctor, I believe that as health professionals, we can lead by example. This is why I welcome the initiative to carry out a survey across 30 countries on health care professionals and on antimicrobial resistance. Andrea has just outlined the main findings of the report, but I'd like to flag some specific ones from my side, if I may. Okay? It is reassuring that almost all the respondents are aware of what IMR is, and in particular that antibiotics are useless against colds and flu. But the survey shows some quite striking difference between the countries. In some, less than half were able to answer all 7 knowledge questions put forward in the survey. It's real. I'm convinced that you all have a closer look at the result from your respective countries and report on them. It is also positive that 75% of participants say that they have easy access to guidelines. Through this number should preferably be higher. On the worrying side, I understand that half of respondents blame the lack of resources and time to provide information to patients. Now, this is regrettable, but it is also another sign that our healthcare system, and in particular the hospitals, are under strong pressure from all sides to respond to urgent needs, IMR being one of them. So how do we respond to these needs? To quote the former British Prime Minister, once again, Tony Blair, education, 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 and once again, the main issue for Labour, but I think for all of us, it's clear that we need to help health professionals. I count on the member states, whose competence include education and training, and to do a little bit more. I know that there are many priorities, but I hope the call will be heard. Now, once again, thank you, and I will be more than happy to answer questions.
Thank you, Commissioner. And now to my director, Andrea Amar, please take the floor.
Yeah, very welcome. The Commissioner just has outlined some findings from the survey that we published today. I also would like to go into a bit more the other data that we published today, as usual, on the antimicrobial resistance and the antimicrobial consumption, because here we have surveillance in the EU since more than a decade. And that also shows that this problem and the measures against antimicrobial resistance are nothing that you can achieve in a year. You have to have a long perspective. Now, what we're seeing for antimicrobial resistance is that for some of the bacteria, like Staph aureus, resistant against methicillin, there is a slight steady decrease, but it's still at a very high level. So what this means is it is possible to really revert the trend, but it takes time and continuous effort. So it's not something that you can do with 2-3 years and then it's good. No, it requires constant effort. And the same is for what we have been emphasizing in the past years with the gram-negative bacteria, the ones with multi-resistant against antibiotics. Here we see, it seems that the increase is stopped. It's still very high, so no incentive to stop doing what we're doing, but it also shows it may have an effect what we're doing. Not yet as to the degree that we want, but it may have an effect. And I think this is, besides all the concern that we still have, also something encouraging that we also need to convey to make sure that people don't lose their engagement, so that they see if they are engaged, it actually has an effect. I fully agree, by the way, with what has been said before in terms of the education. And that is valid for those healthcare professionals that we right now have, but also for those that we will have, the ones that are now in training in the universities. And there we might need different measures to increase their effectiveness in carrying the messages forward. Regarding the healthcare worker survey, I think also it's good that many of them, or most of them, know that viruses are no bacteria, but on the other hand you would think, well, that they should know by training. It is still also concerning to see that it's only 3/4 that realize that a healthy person can be a carrier of antibiotic-resistant pathogens. And that even if you give antibiotics, it puts the person actually at risk for antimicrobial resistance, which also not a large percentage knew. So I think there are also very important aspects where we can use the results of this survey to really target our messages now in the future. I will stop here and leave it to your question.
Thank you, Andrea, and thank you, Commissioner. This is really interesting, and I hope you have a lot of questions. So, ladies and gentlemen, the floor is open for questions.
Irina.
Microphone.
Irina Dergacheva, Intertas News Agency. You said earlier in your speech, in your speech today that you would like to see an international treaty because this is a global problem, a treaty like a tobacco treatment. Could you please care to tell us more about that? Evidently you've thought about that. And the second question, so that I ask it at once. The word on the street says that pharmaceutical companies are in the way of developing the new antibiotics. Is that true? What do you think about that?
Let me start from your first question about international treaty. As you know, we did a lot encouraging, first of all, member states leaders to raise high on the agenda IMR. It was from the beginning, it was German Chancellor Madame Merkel. She did a lot, raising questions IMR highest and highest of G7, then passing both at United Nations, and as you know, the Nations level, now we have global action plan, and we now we have some recognition that AMR is global threat, and it was always on the agenda G10, then G20, and then 3 agencies are now working together, WHO, OIE, and FAO. It would be good to include for the 4th agency, environmental agency. But what we see, we need to have global monitor, for sure. And of course, if we need to have global monitoring, we need to have global methodology, a laboratory network, and standardize a situation to monitor the use of antibiotics, and then to monitor the spread of disease, because bacteria can travel from Brazil till Sweden in few weeks. And when we ask countries to present data varies very much, because the countries are using different methodologies and different laboratory testing. It's of course idea is to encourage global United Nations actors to sign global agreement or convention on common methodology and common surveillance. It's not about possibilities to introduce a ban or so on, because countries are very different, as you know, as you saw from World Health Organization. Some are using bans on growth bans of antibiotics are like growth promoter, some are not. It's a very sensitive issue. But speaking about monitoring, surveillance, and common methodology, it can help all of us. And I am promoting once again, I'm passing those messages that we need some global, agreement which can help us really understand, especially in front of climate change and globalization. Trade is now globalized, trade is very intensive, and we need to monitor it. Otherwise, no one country can fight against AMR being alone, and EU can't also fight AMR being alone. It's very difficult to implement some chapters in our trade agreements. Very difficult one, but speaking of methodology, it will be much easier. We need to have global framework of monitoring, surveillance, and reporting of issues. Otherwise, I can see no problem. And speaking about your second question about how industry can develop new antibiotics, it's a very complicated question. We put a lot of money. Innovative Medicine Initiative is on pipeline. Now we provide a lot of money. Now we put additionally 600 million euros till 2020. But we've known that from some researchers and companies, we have messages, something will happen, but I can't tell you because it's not my concrete DG, it's DG of Research and Development, DG Carlos Moedas, but I can tell you that I know that some messages are that some new types of antibiotics are ongoing. And last year was message out from some consortium from South Africa and on that they are capable to present. But at the moment, I only see that only some positive messages. But how they can develop, I have no data at the moment. May Andrea has something?
No, I wouldn't know about the concrete products either. But I just want to highlight that whatever we have been talking about now with the prudent use of antibiotics and hygienic measures, we still would need to keep that. So I think we should not forget that the interventions that we put now in place, we need to keep them also when we have new antibiotics, because otherwise we are with the new antibiotics very quickly where we are today. And that is why of course, it is very important that new products are developed, but I think we also have to do our utmost to keep the ones that we have today working.
Thank you. This is quite a strong message. Further questions, please?
Thank you so much. I'm Alfonso Di Stasio from Italian Journal for Pharmacists. So at the beginning, Mr. Commissioner, you said that we have to spread in the world about this problem, but we know the antibiotic resistance is not mainstream content, and global mass media, they don't like to speak about this. So we should educate journalists. So how to speak to say how to use very simple words to spread this content, difficult contents. So this is the first point. The second point, should be scared by this super bacteria that come from the eastern country, I mean India, China, and from the place where they are producing these antibiotics. I hope I was clear.
Second question, in more details, at least you see to answer, because we are worried about some countries which are producing a lot of antibiotics, and they have quite big requirements in big requirements in area of environment pollution and so on. They have a lot of discussions about it. But speaking about your first question, but you know, in September we organized Global Vaccination Summit, and it was good news that some social media, Facebook, as bilaterally, we have meeting bilaterally with some Facebook and others to discuss our possibilities to organize common strategy against fake news and misleading information related to vaccination. You heard maybe that Facebook has started to present their action to helping people immediately, if they receive some fake news, immediately to show where they can find a real evidence-based information. How can we inform people about what is real, what is science-based? I think that the same is, I think also possibilities to discuss with main social media actors and with main media about possibilities to develop, some summits and some discussions about challenges. You know all that IMR is global threat. If it is correct, I think it is time to invite media and to discuss about possibilities to use evidence and to provide information to people. I will be more than happy to facilitate such meetings with media, discussing issues about education, about awareness, and about information journalists, that they can keep it high on the agenda, because journalists like headlines. It will be good to organize debates about possibilities to include powerful media into awareness campaigns. And speaking about resistant superbugs, please.
Yeah, I mean, of course we need to be concerned about these bacteria. Again, here the main issue is, the first main issue is awareness, to be clear that people coming from these countries can actually carry these bacteria, and often they are not even sick. Often it is only then a problem when they go to hospital. Become sick themselves, not from the bacteria, but for something else, and are in the hospital. And then it becomes an issue. So I think also here the awareness needs to be raised, not only with the people that travel, but also with the healthcare workers. In essence, these bacteria belong to what I said, where we have now the impression that the increase is halted, but it's on a high level where we still need to be concerned and continue the efforts.
Thank you. I see we have further questions. Please. First here. Yeah.
I've got two questions, and one of them is for the Commissioner. The clinical trials regulation has unfortunately once again been postponed. Was a regulation which was going to put forward patients at the center of research. At the same time, it also adds an extra layer of protection for research in minors and women and pregnant women. Now we know that the drugs are metabolized differently in women than in men. How can we resolve this issue when in new research in antibiotics we're going to put extra layer of protection to include women in clinical trials, meaning that we won't have as many women in clinical trials for new antibiotics, meaning that we won't have the right tools to treat women and minors. How do you think we can resolve this issue in clinical trials? And the second question is for Andrea. Many people are using travel clinics to buy antibiotics to use for sexual health, for STIs prevention, like chlamydia and syphilis. Is there any monitoring going on by the ECDC or other institutions which tracks down the use of antibiotics for STIs? And using these channels, then, are there also any action which is being proposed for these travel clinics to also make available HIV and STI testing kits?
Okay, speaking about first question, generally, not only women, but how can we include patients in organizations, in programs which should be addressed together? Now, as you heard, now is so-called general concept of EU is patient-centered approach. And we try to, to change our regulatory frame in different areas, including debates with European Patients Forum, European Patients Organization, that they should have the right to be invited into European Medicines Agency bodies, because just speaking about clinical trials, we need to understand complexity of regulation, but at EMA level, patients are invited. It's not only about women, about children also, because children also have some specificities, and we need to understand that clinical trials should be addressed not only with generally adults, but of course children, women, and so on. And also we discuss those issues with researchers, because without researchers we have no chance to visit hospitals and universities and those who are involved into clinical trials. And speaking about a legal framework, now European Commission is in a way to evaluate today's legal frame, especially pediatric or orphan drugs regulatory frame. A report is ongoing, and as you know, Commissioner designate has mandate to present new pharmaceutical strategy of EU. It means that we need to draw attention on possibilities to discuss issues. How can we facilitate, mechanisms to include into clinical trials some specific targeted group, which it should be. And without patients' organizations, without involvement, which it will be difficult. And we need to have all actors on board. Pharmaceutical industry, researchers, EMA, Commission, patient organizations, and health professionals. And then to discuss common platform, how can we develop. It's really very complex, very difficult issue, and this requires a lot of debates, and of course ethical issues, of course responsibility, data protection, and so on. Very complicated area. But patient-centered approach now is cornerstone, and we will next commission will go in such direction, keeping it in mind.
So then the question regarding the travel clinics and STIs. So we are not monitoring clinics, neither the travel clinics nor hospitals. So these are in the competence of the member state. So they have to make sure that everybody who diagnoses, treats patients, follows the legislation of the country. What we do, however, is in particular for HIV and hepatitis, but we have to see whether we can do something similar for STIs in general. We work together with a company that produces an app for testing, so that basically there is also, actually, I think it's this week or next week, the testing week. So that people, when they have this app, they find a testing site very close by. So that is something that we have found is a tool and a way of communicating with those at greatest risk for STIs and for HIV. And the availability of testing kits is again something that can be from our side be labeled as a potential option, but whether it's put in place is really the decision of the member state.
Thank you. We have one question there.
Hello, my name is Sasuya Kili from the Greek newspaper Kathimerini. Obviously, there are some European countries that make less efforts to fight antibiotic resistance for several reasons, lack of resources, etc. Could you name some of these countries, and what could you do to persuade their governments to be more active?
Okay, as you know, it's not my job to blame countries. Absolutely.
Neither mine.
Mention, not
It will be a very wrong approach. You can read country profiles and can read country by country report. And it's up to you to see picture and up to you to use data. Because our approach is we can facilitate, cooperate, encourage, monitor. Of course, you know, sometimes we have in our hands impeachment procedures. If you follow cross-border healthcare directive, you can find how many countries were with problems. And till now, we have, you know, so-called difficult debates about. But it's not about blaming Asia. But I know that you just mentioned many reasons why. For example, we have a lack of nurses and doctors. What can you do? You have abandoned regions. You have, you know, remote areas where you have no instruments. Of course, in those regions, we have a problem. It's up to governments to present their action plan. How can they solve those problems? And Commission is ready to debate those issues using different instruments, including, now we have new instrument, the European structural support, advisory group, which can deal with those issues. But it's not up to us to say blame and shame. Countries' profiles are open. State of health in the EU is open. Survey is open. Please organize debates in your country, and I will be more than happy that those debates will be fruitful.
Yeah, just in continuation. I mean, the data are clear. What is sometimes not so clear is why they are as they are. And as the Commissioner has said, there are many different reasons. It's sometimes the infrastructure, sometimes the lack of knowledge and education, and sometimes really just the lack of staffing. It's also very interesting when you look in the survey. There was a question on where people have to indicate whether they have prescribed antibiotics, although they didn't want to, and it was very clear that the main reasons were fear of complications or unclear outcome, but also that it's easier to prescribe an antibiotic than to explain why not. And in particular for practitioners in the community, they want to maintain the relationship with the patient. Now these results give really a good basis for targeted interventions. So it is very clear that the physicians need to be supported in their communication, so that it's not a lengthy communication that they have to invent, but they know very clearly how to communicate this. But also on the other side, for patients, that actually the fact that their doctor isn't prescribing an antibiotic is not because he doesn't like them, but it's a special expression of care from the doctor's side. So I think there's a lot of angles from which we have to take this, and what we have learned over the last years is really there is no one solution that fits all the countries. These data have to be looked at a country-specific level and then discussed with the health authorities how to address the issues. And we are happy to support them, but they have to really make the decision.
Thank you. We have one question here.
Hello, I'm Francesco De Lucinis from Corriere della Sera in Italy. And just a question for you, Commissioner, about you mentioned many times the problem of antimicrobials, antibiotics used in animal farming as growth promoters. And this is a practice that is not allowed here in Europe, but we still we import a lot of meat. I think poultry meat, mostly from other countries, tier parts countries that use it as growth promoters. And so the question is, you partly mentioned that can we include this in the trade deals that we are doing, like Mercosur that you mentioned in your presentation, for example, not just if we can just ask them to monitor the use of these antibiotics, or if we can ask them to export meat in Europe only if this accomplish our ban of use of antibiotics as growth promoters.
Thank you. As I mentioned, we have in trade we have bilateral agreements and multilateral agreements. One of the last multilateral agreement between EU and Mercosur countries. Very comprehensive agreement in which we include IMR into agreement. Of course, also very close issue speaking about IMR is animal welfare. And we also try to include animal welfare into trade agreement. But speaking about bilateral issues, you know that we are bilaterally discussing problems, side by side, knowing that all countries who can send their goods and meat and food into EU, they should follow our European Union certificate. And only after when they were allowed to have European Union certificate, only we are sending audits and we are inspecting and we are looking, do they follow our food safety requirements? We are not allowed to diminish our food safety standards. In no one third country has the right to send their food if they are not follow European Union certificate. And as you know, not all entities have the right to send. We have a bilateral agreement with Brazil, but not all entities can send their food to EU. Only those who were certificated, monitored, audited, and we know a situation with their capacities to keep high our food safety standards. It means that we are excluding situation. And also, you know that we always have the possibilities to monitor. If we have follow situation, have some residuals, we are immediately reacting because our food safety standards do not allow to enter those products with some residuals into EU. But in media is very broadly disseminated one of fake news. I have a lot of debates in Italy, because in Italy some political parties organize some, showcase. Look how many bad things do we have, because they did it from political reason, but not from evidence-based reason. And I ask, please present evidence. Then it was zero evidence. Or if it is evidence, they should react because it's up to Italian official control, immediately stop, ban, and to exclude, but not to allow to trade. This is something from misinformation and fake news. And I know that a lot of evidence, of course, we have fraud, we have difficult activities, but official control on the ground should react immediately. We are not, and we are doing a lot of initiatives with IMR. And as you know, we try now to have common standards through World Animal Health Organization. Now we adopted some animal welfare standards at World Animal Health Organization. It can help also to solve problems with IMR. Now OIE, FAO, and WHO are partners in fighting against IMR. I am positive that we can make influence on all third countries which can, develop their food industry following common positions of 3 organizations in the area of IMR.
Thank you. We will be taking the last questions due to the time.
Yes. Hi, my name is Annika Östman from the Swedish Radio Science Department. And I would like to ask about the health survey, health professional survey. I mean, they realized that it is a relation between prescription and MAR. And but concerning the big responsibility, they didn't realize. I mean, how come, and what will you do about this situation? And then for the commissioner, please, what would you like to tell the Swedish radio listener as your last word concerning this subject? Now, as you have had your last speech here in Sweden, please. I'm sorry, I will just leave. Check, so I have the, yeah.
Provocative, message to Swedish, people. But if I may, first of all, I thank Swedish society very much, because Sweden do at local level very good job. Generally, we are proud Swedish model of awareness, of engagement, and of worries about climate change, IMR, and food safety is very high. And this encourage us to present a Swedish example as example which can be learned in all 28 member states. And of course also I know that very well that we always should be very careful when we are thinking about new challenges, because resistant bacteria can enter from different parts, and we all, sometimes we all can be transmitters of infections of resistant bacteria, and we need to keep high on the agenda awareness, education, and to campaign, all year when we are thinking about such global threat. IMR is global threat, please understand it. doesn't matter that Sweden has good capacities to fight against it.
Yeah, regarding the yeah, it looks like discordant results that someone who prescribes antibiotics knows that this has an influence on AMR, but that he or she himself doesn't have. When I read that, I also thought it's quite intriguing, and I don't have an explanation as to why it is like this. It is now for really using the results to make clear what is behind this, because it seems that certain pieces of knowledge don't connect, and that is something that is the same for someone who smokes, and although he or she knows it causes cancer. So we have to work with the results now. I can't explain them right now.
But were you surprised?
Yeah, I mean the logic would be that if you prescribe and are aware of the influence that it can have, that you also would perceive yourself as someone who has a key role in managing this influence.
Thank you, ladies and gentlemen. Thank you, Andrea, and for all the work that ECDC has done with the EAD, and you, Commissioner, for being our supporter, for supporting the EAD throughout the years, and we hope that you remain active in this and to vaccination as well, the areas that are very close to the ECDC. So, ladies and gentlemen, also, we thank you very much for attending. We thank you for following the work of the ECDC and EAD, and hope to see you again next year.